So if you're dealing with esophageal spasms, in this video we're going to try to help you understand what could be creating this problem for you and steps you can take to improve the situation. And with this issue, there doesn't seem to be a lot of clear-cut information as to what really is creating this, and it's important to understand that the underlying cause can really vary from person to person, and that's kind of what we see with most issues, so that makes sense. But when we're looking at spasms, there could be distal spasms or there could be hypercontractile spasms that are very forceful. They call that like jackhammer spasms, and since there is not clear-cut information, I like to look at other things where we can see these issues happening in other parts of the body and what's creating that, and see if that can help us make sense of why we would be having spasms there in the esophagus. And with most people that are having spasms, they're also having some type of dysmotility issue, because a spasm is a form of dysmotility where maybe they're having food or maybe some type of supplement kind of gets stuck in their throat a little bit, or they're having dysphagia swallowing type issues. We have other videos where we've talked about that a little bit and how I improved that issue for myself when I was dealing with that years ago. But the first thing that we want to think about when we're looking at these spasms is we want to look at digestive aspects and what's going on down here that can be creating trouble up this esophagus here. So let's look at this study here on outcomes after treatment with proton pump inhibitors in patients with ineffective esophageal motility. And they say evidence from included studies indicates that although PPIs are effective in healing esophagitis, they do not consistently improve esophageal motility, irrespective of PPI type, dosage, or treatment duration. So that seems to be a pretty common treatment that the medical world will use for this issue, is using some type of PPI medication or a proton pump inhibitor that turns off this stomach acid. They often use that when someone's having acid reflux and acid is coming back up and burning them and creating all this irritation and inflammation in the esophagus. So they use those to kind of turn that off. But this study here is showing us that it doesn't really correct any of the dysmotility or spasm type issues when they do this. So to understand why that is, we really need to understand acid reflux. And it's important to understand that reflux is not usually caused by too much stomach acid like advertisers want us to believe. It's most commonly caused by a lack of stomach acid. So when there's not enough stomach acid in there to trigger this LES valve, or lower esophageal sphincter at the bottom of the esophagus, to close properly, then the small amount of acid that we have in the stomach comes back up and it burns us and it creates all of this inflammation. And inflammation on tissues has the ability to cause those tissues to react in a variety of ways, and spasms could be one of those ways, especially when they're affecting nutrients in those tissues. We'll talk about that in just a second. So when someone is having any type of dysmotility issue in the esophagus or spasms in the esophagus, the first thing I want to know is, are they dealing with a hypochlorhydria issue or a low stomach acid? So if you don't know if that's a problem for you, we'll have a link in the description below for our video on 10 signs of low stomach acid, and you can just go through that and see, oh, do I have a lot of signs of low stomach acid? If that's the case, then improving that situation could create some improvement for me. But when we're helping clients fix any type of spasm or cramp issue, we always want to know what's going on with calcium and magnesium at that tissue level. So let's look at this paper here on symptoms and management of tetany, which should not be confused with tetanus. That's a different situation, but they say tetany is a series of symptoms characterized by painful muscle cramp that derives from enhanced neuromuscular excitability due to hypocalcemia, hypomagnesemia, or alkalosis. And our understanding is that the calcium is very important at that tissue level to allow those tissues to relax. So when there's not enough calcium in that right location, it can cause those tissues to spasm or cramp. And magnesium often has a lot to do with this, helping calcium get into the right place in the tissues as well. So magnesium can be very important. And this study went on to say that infusion of calcium or magnesium is effective as an acute therapy for tetany. So they were putting it right into the patients, and when you do that, it can go right into the system. But just supplementing with calcium or magnesium is often not enough to fix this for most people, because we need to be able to assimilate the calcium and the magnesium. And I've gone over a lot of studies that show us that we need stomach acid to be able to break our food down well enough to access the minerals in our food. So if we don't have enough stomach acid there, not only can that create that reflux and inflammation issue, but that can also restrict our ability to get enough calcium and magnesium and other nutrients out of the food that we're eating. So when we start to create deficiencies in these minerals, now those tissues are not going to work correctly. We're going to have symptoms like either cramping or spasm type issues. And when we look at this study on proton pump inhibitor induced hypocalcemia presenting with carpal pedal spasm, this is a different type of spasm, but it shows us that when somebody is using a PPI, it has the ability to create a hypocalcemia issue because they don't have the ability to access all the minerals from their food when they're turning off that stomach acid. So it's important to understand how crucial that stomach acid is when we want to get all the minerals out of our food. But a person doesn't need to be on a PPI. There's a wide variety of reasons that can restrict a person's ability to make enough stomach acid. We'll come back to how to get an idea if this might be a problem for you, but I also want to look at this study here on distal esophageal spasm, and they say the evidence links nitric oxide deficiency as a culprit resulting in disordered neural inhibition, and GERD frequently coexists with this issue. So they're often seeing GERD or acid reflux with these types of issues, but they're also saying that when we see these spasm issues, that there appears to be a nitric oxide deficiency. And this is very common to see when someone is using some type of mouthwash or some type of dental cleaning agent that is wiping out their oral microbiome. We need to have oral good bacteria in our mouth just like we do our gut. And this bacteria helps us to process foods in a way that allows us to create nitric oxide, which is used for a lot of bodily functions. So it's just interesting that these people are seeing this with this issue. So if you're using some type of, mouthwash or something, you might want to cut down on that, as well as taking some type of steps of maybe using an oral probiotic. I'm not going to give you a specific brand or anything. You'll have to do your research on that. But you may try using an oral probiotic to see does that create some improvements. You can even find nitric oxide test strips where they're just saliva test strips where you just put it on your tongue, test your saliva and see is your nitric oxide really low or not. If it is, then you know, okay, I might need to do some work here on that to improve that situation and improve my oral microbiome so that my body has the ability to produce nitric oxide the way that it's supposed to. Now, just keep in mind that if your doctor is telling you to use a PPI, I'm not telling you not to do that just because all these studies are showing problems that they can create. Remember, I'm not a doctor. I'm not giving anybody medical advice. I'm basically a professional stand-up comic turned nutrition author because when I lost my voice for 8 years and 23 different doctors couldn't figure that out, I had to dig for my own answers. So now for 20 years, I've been teaching health professionals in more than 40 countries how to help their clients fix the actual underlying causes of problems instead of just covering up the symptoms. But we'll have these studies here in the description below so you can go through these and figure out the right questions to ask your doctor. But since we're seeing that this has the ability to be caused by different things, some things that you can do at home to get an idea of what may be creating trouble for you is one thing you can look at your blood pressure. You can pick up a blood pressure cuff at any pharmacy for $30 or $40. And just look at your blood pressure at least 2 hours after a meal, and if that systolic number, which is the top number, is lower than 112, that's a really strong sign that mineral levels in general could be going low in the system. Now, that's not a diagnostic thing in any way, but if it's like 99 over 68, that's a pretty strong sign that minerals could be going low, and that may be part of what's going on with this calcium and magnesium not showing up in the right places. We can also look at these nitric oxide strips to see is the nitric oxide issue the issue that could be creating this for me. And another thing you can do is you can get some urine pH test strips on Amazon or at local health food stores. And if you can check your urine pH and at least 2 hours after a meal, if that urine pH is like 6.3 or higher, that can be a possible sign that you could be peeing out too much calcium. A lot of times people are doing things that kind of pull calcium out of the tissues where they need to be, like maybe they're eating way too many carbohydrates or sugars, maybe they're getting way too much sunshine, maybe they're supplementing with way too much vitamin D. Some of the suggestions for vitamin D dosages that people give now are way too high for some people. So if you're doing any of those things, that can pull too much calcium out of the tissues, and the body will start to pee some of that out to get rid of it, and you can see, oh, okay, I might be pulling too much calcium out of my tissues. I need to take some steps to improve that situation. Maybe using a supplement called lysine to help push calcium back to the tissue level, maybe reducing carbs and sugars or vitamin D or sunshine. And then when the calcium gets back to the right place, does that help improve the spasms for you? I don't know. You're going to have to test that out to see what's going on with you. But these are at least some steps that you can take to get an idea of what do you really need to put some effort in. You don't just want to throw darts at the remedy dartboard. We want to look at what's going on to fix what's actually causing the trouble. So I hope that gives you some helpful insights. And if you know that you are dealing with acid reflux, that really has to be corrected to stop this inflammation that's going on there. So you can jump over right now and check out our video on what's causing my acid reflux. I can't wait to hear about your results.